Well, we'll see. We'll see how this goes.
Morning, Representative Melissa. Support our friends and communities today. Thank you.
I'm Representative Melissa Blasek. I represent Hillsborough 21 here in New Hampshire, and I ran for office because of COVID. I remember during the lockdowns, looking at my daughter's crib and thinking, we've given up all of our rights and she's not going to live in a free society. So I decided I was going to do something about it, and I ran for office. And we are here today. We have a lot of bills coming up today related to COVID and health freedom. We are going to be voting on a bill that would make Ibermectin over the counter via standing order. We would be the first state in the country to pass anything remotely like that. We already passed a bill a couple weeks ago to prohibit doctors having their licenses revoked for off-label prescribing and pharmacists having their licenses revoked for off-label filling. So we're getting started on that issue, which I'm very proud of. And we have a lot of bills upcoming about surrounding the vaccine mandate issue. We have a bill that would make us a sanctuary state in regards to federal vaccine mandates and vaccine data collection. So we'll have that one upcoming today. We have a bill to prohibit, actually it's to require state, any business that receives state or federal funding, that they have to have a very simple, streamlined vaccine exemption policy if they have a mandate, so that they just sign a form saying that they have a exemption of religious, medical, or of conscience. So we have bills like that as well, and it's going to be an exciting day. We've moved the Overton window a lot. People thought I was a little crazy last year when I was already talking about this stuff, but we did accomplish a lot last year as far as state of emergency reform. We essentially pressured the governor into ending the state of emergency, and we got some very in-depth state of emergency law reforms, and we are continuing that work this year. I have another bill that I actually prime sponsored that will further state of emergency reform today. I think that my Republican colleagues are starting to see that we need to take ownership for putting the nail in the coffin of failed COVID policies. And we seem to be working well together and holding together on these issues. So I'm very excited about that. Yeah, unfortunately, COVID's become very partisan. I was supposed to do a speech, but then we tabled the bill, where I was literally going to say that. I mean, this has just become a partisan, politicized issue, which is absurd because there's nothing about these issues in particular that have anything to do with either party platform. But where we are right now is that Democrats have repeatedly voted against medical freedom bills, and the Republicans have repeatedly supported medical freedom bills. So that's where we are. We have managed to come to some types of bipartisan support for some of the state of emergency reforms, but not even much of that. So it's unfortunate. Some of the Democrats have started taking their masks off, but there's only like 5. So this has been a pattern that in hearings for bills on masks and vaccines, we bring in, for our side, doctors and scientists who explain the science, and the opposition never talks about the science, ever. It's really shocking. In fact, just yesterday we had a bill that we did pass to prohibit school mask mandates, and my speech dove into all of the studies on the lack of conclusive evidence that masks do anything helpful. And the opposition, well, actually, they kind of, there was a lot of negative reactions from the crowd when I was talking about that, number one. And number two, the opposition debate had nothing to do with the science whatsoever. They were only concerned that there was an enforcement mechanism in the bill that would make it a code of ethics violation if an educator violates it. That was all that they were concerned about, not the science at all. And that's, like I said, that's been a pattern with all of these bills, all of the mask and vaccine bills. In the next 6 months, we will conclude our bill-making process. Our bill-making process in New Hampshire is actually kind of long. Compared to other states, we do about 6 months worth of work because every bill has to have a vote by the full legislature, and that's very unusual. So it takes us a long time to sludge through them. And my hope is that we're starting to see the COVID response close, but we need to make sure it never happens again. So, ending any type of mandate, any type of, mask mandate, vaccine mandate. What I think we're going to accomplish in the vaccine mandate front is I think that we're going to make some strides forward on the employer mandate issue, make a lot of strides forward in pushing back against the federal government and the federal overreach on that particular issue. And we're starting to work to redo this is an issue that everyone should look into in their state, the vaccine registry that's in your state. We were the last state in the country to get an operational vaccine registry, and that is data collection. That's going to be a future mechanism that they can use to oppress you. So we've done a lot of work this year, and I'm very proud of that, on protecting your medical privacy, again, making that as restrictive as possible so that you have full informed consent before you are in that database, that no one can sneak you into that database without your knowledge. So we've done a lot of work on that this year, and I suspect that will all go really well, actually. And I'm really hoping that we make big strides forward on medical freedom, and I don't mean that in health freedom, like as in you get to make your own decisions for your body, but that you also get to choose your medical care that you want in a proactive manner also, that doctors can be doctors and practice medicine without the government stepping in and restricting them. So I think we're really opening the conversation on that here. The two biggest issues I hear from my constituents are, and this is not even a question, I don't hear about any other issue even remotely close, is school mask mandates and employer vaccine mandates, specifically after the federal government had all of their mandates. But even besides that, those are the two biggest issues I hear about, is that people want to be able, number one, I think most of us actually do realize that masks are ineffective and they've become a talisman of COVID theater. And number two, that people want to choose what medications they take and what medications they don't take. So we've done very well in committee. Most of these bills have an ought to pass recommendation out of committee. So that's always a really positive first step. It's really just a matter of making sure that there are enough butts in the seats so that we can pass them. So like I said, we have one that's, again, there will be an ought to pass motion on making Ibermectin over the counter via standing order. There is rights of conscience for medical professionals. They essentially, medical professionals can have the right to say that I have a conscientious exemption to a vaccine. There is a bill, so we're very into removing bureaucratic authority. Your elected representatives should be the ones who make decisions over your life, not an unelected bureaucrat that's unaccountable. Currently, and this is the case in most states, the commissioner of DHHS adds the vaccines to the school vaccine schedule. We have a bill to remove his authority over that, so that if a vaccine is ever added to the school schedule, it has to be your elected officials that make that possible. We have a bill, yes, to make us a sanctuary state in regards to COVID vaccine mandates from the federal government and data collection. We have a bill that would prohibit the state of New Hampshire and all of its political subdivisions from ever mandating a vaccine for a business. So kind of like what happened in a lot of the major cities around the country, New York City, Boston, we want to say that in New Hampshire, that will never be allowed to happen. We have another bill that says that if you are a patient in the hospital cannot say that you can't have visitors. You need to be able to have a patient advocate there. We've seen a lot of issues across the country, or even right here in New Hampshire, with people going to the hospital, maybe for COVID, maybe not for COVID, and they don't have anybody there to back them up, and they don't always get the best care when they don't have somebody advocating for them. So, and in addition for that, it's inhumane to not have your family there when you're dying. That's happened all over the country, so we have a bill to prevent that. So I think that it's gonna be a big day, and you're gonna be seeing those absolutely today, and all of those are already ought to pass out of committee.
We've heard a lot of bills in my committee, the Health and Human Services Committee, about patient rights, individual rights, and how to balance those appropriately. We've had a lot of people push towards mandating things without realizing that informed consent is crucial. That's the underpinning of our society and the way that we approve drugs and medicines. So when people try and force their will on others, we're actually undermining the whole process. And we build a lot of mistrust, because if you have to force me to do it, what don't I know? And that itself is actually undermining public health more than anything else that could be done today. So we have a few different bills. We have one that is a risk reduction so that we can get access for people who want Ibermectin and don't want to go to the farm store or order it from India. We'd like to make it so that they have a process to get stuff that's manufactured in approved facilities here in the U.S., so we know it's not adulterated with anything, that there's nothing extra in that Ibermectin, so that if they believe the benefit is there, then they have that opportunity to do it with a safe product. The federal mandate one is huge. So in the whole United States, we have the 10th Amendment. Any powers that are not given to the federal government are restricted, are retained for the states and for the people. We have an executive branch that hasn't been able to force people on their own. So they're taking their different agencies and trying to force it through rules. That's not right. It's not appropriate. It's not constitutional. And we have a bill, House Bill 1455, sponsored by the Speaker, that will tell DC, no, we will not enforce these rules or mandates for you. That's your job. You're not paying us to do it, and it's not the right thing. So please stay in your lane, and New Hampshire will not enforce these for you. 1495 was one that initially had been broader ranging. We have some other bills in other committees that will deal with exemptions. What we did is we said that no state or local government can require businesses to require vaccination. So it's still silent on what the businesses can do. In New Hampshire, people are really arguing strongly that businesses have that right, and when there's full and fair competition, I'd agree. We have some areas where there's not free and fair competition, so the real debate is what we do in those situations. But this bill, 1495, says that no state, no town, no city, no school district can force a business to require proof of vaccination. So these past 2 years made me make the move from a private citizen to a public servant. Before I filed to run for office in June of 2020, my life goal was that nobody that I didn't know would know my name. I saw big problems coming because people were acting and legislating out of fear instead of out of thoughtful review and thoughtful concern. I ran because I expected that there would be a whiplash of reactions, and we've seen it. So I've been here to throw my body in the way of that whiplash and try and bring things back to a well-reasoned approach so that we can honor everybody on every side and not force anybody to do something that they're not comfortable doing.
So my name is Andrew Prout, and I represent Hillsborough County District 37, the towns of Hudson and Pelham. This is my third term currently. And so, the whole state of emergency reform kind of started back last term. Once we were back in session and we were meeting off-site at the Whitmore Center, I introduced on the floor a joint resolution to partially end the New Hampshire state of emergency. Basically saying that the governor would need legislative approval for any new emergency actions and ending some of the emergency orders and continuing other ones, trying to really get us out of, pure executive rule, which is what we were in at the time, and into something a little bit more joint, a little bit more targeted, a little bit more, negotiated and with legislative oversight. So there were some things, and this is why I did a joint resolution that only ended some of the emergency orders. There were some of the emergency orders that were good, and some of them were okay. I mean, one of the ones I used as an example is there was one that allowed you to do notarized documents by video chat, and there was really no issue with that. I mean, that was a good public service one, and there were some other ones, and I don't remember offhand the full list of what I was going to allow to continue, but there were quite a few that were good. They were okay, and they were targeted, and they were very much related to the situation at hand. That was actually, it was a good thing that there was some executive authority to make those really, really quick decisions to address some pending issues. But, and that was all my point all the way from the beginning. As soon as the legislature is back in session, we should address that and either ratify them or not, and also kind of take the reins back. The executive emergency power there is to make the emergency snap decisions that need to be made faster than the legislature can assemble. Because here in New Hampshire, with 424 legislators, it takes a little planning to get us all in one place at all time. And we have to recognize that. But that doesn't mean once we're not back in one place, we shouldn't return to the normal process of passing legislation and having votes on things. So one of the things that's going through the process right now, and actually passed the House a couple of weeks ago and will soon be before the Senate, is yet another bill to kind of do the after action of the emergency powers, because there's a lot of things that the governor did that had effects that lingered and required follow-up that aren't being done by emergency order, which is a good thing, but still something that needs to be. And one of those ones is Emergency Order 76, which had a lot of people, which suspended the ability for people to opt out of the vaccine registry. So even if they wanted to, they couldn't prevent the state from collecting their data. And so I have a bill going through that will follow up on that and make sure there's a public information campaign saying, if you didn't want your information to be held by the state and you didn't have the opportunity to opt out, you can now follow up with the Department of Health and remove your information from state databases, which could be what some people intended from the beginning and were denied that right. So one thing that I've learned being a legislator is that people very much so in the legislative process look to what has happened in the past as precedent. And so ignoring things because they're past, they're gone, they're over, and not doing that follow-up work to address what you felt was wrong, even if it's at this point quasi almost symbolic addressing it, allows the precedent to stand unchallenged. And so, just about the bill I just mentioned, and that's one of the reasons it was actually passed unanimously in the House on the consent calendar, is because it doesn't have a major impact, but it is a symbolically right thing. We have the principle of, respecting privacy in the state of New Hampshire. We have the principle that we don't collect people's information without their consent, either an opt-in or opt-out basis. And we didn't live up to that, and so we need to address the fact we didn't live up to it. But anything that you see that you didn't like that happened, try to get it addressed, even if it's mostly symbolically because the right moment has passed and we weren't able to do it. Try to get it addressed, because that will affect how people view it as precedent.
Hi, my name is Representative Leah Cushman. I represent Ware and Deering in New Hampshire, and I'm on the Health and Human Services and Elderly Affairs Committee. I'm a registered nurse by profession, and this session, a lot of my constituents have asked for us to put some stops in place against the tyrannical effects of the reaction to COVID. So in the Health and Human Services Committee specifically, we've been putting through legislation to curb the ability for vaccine mandates and also for expanding treatment options. So I filed a bill, HB 1022, and that's the Ibermectin standing order bill. So it would make Ibermectin available over the counter via a standing order. And a standing order is basically a prescriptive protocol written by a physician and given to the pharmacy, and then a patient could go to the pharmacy and ask for the medication. As long as they get through the screening questions for contraindications, allergies, things like that, they can have it dispensed. So before the bill, if the bill never came through, we continue seeing what we saw this winter a lot of people ended up really, really sick and had no access to early treatment. Hospitals weren't treating anybody outpatient. Only when you got to the point where you couldn't breathe and your oxygen saturation was below 90 would you even be admitted and even given oxygen or anything else to deal with your symptoms. And so with the passage of the bill, people will be able to get the drug for prophylactic treatment if they come in contact with somebody, or if they know they're going to be somewhere that's crowded and they're concerned about getting infection, or if they develop the illness, they can get the early treatment and likely reduce the severity and duration of their symptoms. So I've seen a huge shift in the ethical viewpoints of medical professionals, from one where we defend bodily autonomy and the right for patients to have complete informed consent and have the right to try off-label treatments, and now there's a lot of resistance to that, and even so far as the medical board saying that they'll punish doctors for prescribing medications off-label, even if they've been shown in studies to be effective in reducing symptoms of COVID. So yeah, I've just seen a real shift from where it's like patient-directed care to we're just going to listen to whatever the regulators say and the professional organizations, and more algorithmic and policy-driven healthcare than innovative and keeping in mind what's good for the patient.
Every citizen has a natural, essential, and inherent right to bodily integrity and free from threat or compulsion by government to accept an immunization, and we have affirmed that right. Just last year, in the passage of HB 220, the underlying law that this bill seeks to amend. Mr. Speaker, if I further know that this bill seeks to make a subclass of New Hampshire citizens where that natural, essential, inherent right would be taken away. And Mr. Speaker, lastly, if I want to protect all New Hampshire citizens, reaffirm that natural, essential, and inherent right to bodily integrity free from threat or compulsion from government, would I now press the green button and support the table motion?
The motion before us is to lay House Bill 1132 on the table. This is a roll call vote. If you're in favor, you'll press the green button. If you're opposed, you'll press the red button. Voting stations are open for 30 seconds. 42 voting nay. House Bill 1132 is laid on the table.
So 1332 was a bill to repeal a law that we passed last year that prohibit public universities from having a COVID-19 vaccine mandate. And the bill was tabled. We're facing a lot of bills this week, so we are tabling bills, essentially a lot of them that we want to kill. So that one worked out really well.
It is officially seconded. This is a roll call vote.
It's Naomi Wolf of Daily Clout, and I am asking you to please, if you like the video you just saw, support us, become a member, donate. You can send checks to P.O. Box 24, Millerton, New York, 12546, or go to Daily Clout, DAILYCLOUT, become a member or donate. Thank you so much for your support. Every penny goes for paying our hardworking staff, paying hosting costs, and paying our lawyers who have been leading the fight to keep you safe and free, to keep the Constitution safe and to keep you free. Thank you so much.